My name is Leslie Daigle, Marketing Coordinator for TechScan. Most dentists are amazed by the power of the T-Scan when they see its capability. However, they are not always sure how to use the system in their practice to impact their bottom line. In this presentation, I will share with you several ways to do so. Include the T-Scan as part of your initial exam on all new patients that enter your practice. Find a potential occlusal problem and take the necessary steps for diagnosis and treatment. With articulation paper, you cannot determine the force or sequence of contacts. All you see is contact location and surface area. Because the T-Scan can measure timing and force, it is an indispensable tool for evaluating the sequential relationship of an excursion. This is important in locating interferences and evaluating the potential trauma. Once you have diagnosed the patient, the T-Scan is an excellent tool for patient education. They can view the data, which helps them to understand the necessary steps for treatment. Once the patient has agreed to treatment, finish the case with the T-Scan to ensure their dental work will last. Your patients expect the best treatment from you, which often translates to having the latest and greatest in technology. Patients spend a lot of money on their dental work. They need to know this technology will help ensure it's going to last and function properly. T-Scan technology is not available in every dental office, which makes this service you provide unique. It also shows your staff and patients you are investing in yourself to deliver the best care possible to your patients. So now that you've invested in this technology, you need to educate your patients and staff on the benefits of the system. Your patients should know that you are the expert in computerized bite analysis. Give your patients and potential patients a reason to come to your office by communicating the benefits of the service you provide. The T-Scan system helps to improve results by minimizing destructive forces, which preserves the dental work. You can also easily pinpoint problem areas that the clinicians without this technology cannot. As a result, you can eliminate extra visits, saving your patients time and money in the long run. State in terms that are easy to understand and hit close to home, such as, the improper function and imbalance of your teeth coming together can cause pain, fractures, nighttime grinding, increased headaches, neck pain, tooth wear, and so much more. Educate your patients and send a consistent message on the benefits of the state-of-the-art device offered in your practice. When a patient calls in, tell them about the T-Scan technology and how it can help evaluate their bite and eliminate problems down the road. Have a patient education brochure on the T-Scan system readily available in your waiting room. A great resource that has a T-Scan education brochure available for purchase is Dental Marketing, Inc. In your marketing efforts, encourage patients to ask about having their bite analyzed with the T-Scan by including it in voicemail and on-hold messages. An example for your on-hold message could be, ask how a simple bite analysis with the T-Scan can help increase comfort by eliminating damaging forces. Share patient testimonials and success stories on your webpage to show how the T-Scan has helped so many of your patients already. A patient recently wrote to TechScan wanting to share their story on how the T-Scan system changed their life for the better. There are no words to fairly express just how competently this device works. I had been to another cosmetic dentist for almost 6 months trying to get the bite right on a 6-unit upper front bridge without success. I had already spent almost $15,000, but due to bite problems, felt that I had merely had a cheap $200 set of dentures instead of the Hollywood smile I had been promised and expected. I was horribly disappointed up to this point. Upon your referral, I went to a T-Scan user. Using the T-Scan, he spent less than an hour and totally resolved every bite issue in my mouth. Every dentist in America ought to have one if he or she truly cares about providing the best care for patients. How do you get your existing patients interested in wondering how this technology can help their bite? Simple. Get your staff involved. Your staff should always be up to date on the latest technology in your practice. Spend the time to provide the proper training to everyone in your office so that they understand the added benefits of using this technology. Provide scripts for your receptionist. If a patient calls in with bite problems, ensure they will promote the T-Scan system by stating, "Well, you came to the right place. Dr. Smith has a T-Scan system that will help pinpoint the problem area instantly. He is one of a handful of dentists in the area that has this technology." Encourage staff, who are your best advertisers, to use and promote the T-scan system as a preventative part of your practice. If your staff is using the system and talking to patients about the benefits, the patients are more likely to listen. Here are a few examples of some of our customers that have included the T-scan system as part of their website and marketing efforts. Display prominently on your website that you have this unique technology available, along with the expertise to properly diagnose and treat. Explain how the system works and how it will help their bite. Tell them how easy it is to determine and restore the balance of their bite. As a result of his online presence, Dr. Robert Kirstein, a consultant with TechScan, has patients from all over the country contacting him about this technology because they have been suffering for years and have been improperly treated. If you are not online promoting yourself, then you are missing these opportunities. Use these channels to promote that the equipment is part of your practice. Emphasize the patient benefits in your advertising plans, whether it's your local yellow pages or a promotional mailer. Contact your local news channel about the advanced technologies available in your practice to more accurately diagnose your patient's problems. TechScan frequently fields calls from patients seeking a dentist that uses this technology because they have seen a news program about it. We have an example of a clip that one of our users, Dr. Clifford Williams, put together.
Well, many people don't like going to the dentist, so when you get a crown or a veneer, you want it to stay put. But if you're one of the millions with a misaligned bite, your teeth and implants can break more often. Now dentists have a new tool to give you the right bite. When Olga Maggio had a crown placed over a bad tooth, she thought her dental troubles were over, but it was only the beginning.
I always had problems trying to adjust the bite, and it never felt good. So my jaw started hurting, and then it started popping and clicking.
Olga's pain was due to a misaligned bite.
Ideally, when we bite together, we'd like all teeth biting with the same amount of pressure at the same moment in time. Rarely does that happen.
About 80% of Americans have a bad bite, putting them at risk for broken teeth, TMJ, and other problems. Biting down on carbon paper helps mark trouble areas, but saliva can smear the ink, leaving room for error. Now, more and more dentists are using a computer-based technology called TechScan to spot bad bites. Patients bite down on a thin, flexible sheet embedded with thousands of tiny sensors that send bite pressure information directly to a computer.
So when the patient bites, you can see the graphic display on the computer.
The red indicates the most forceful bite.
Those forces can range anywhere from 200 to 800 pounds per square inch. That's a lot of pressure being applied.
Olga's test here shows that she's biting extremely hard on the left side where her crown is. Armed with that information, Dr. Williams can now accurately adjust Olga's bite and relieve her pain, giving her something to smile about. Now, Olga says the strip tasted just like cellophane, and it wasn't that uncomfortable. Normal dental x-rays do not show misaligned bites. TechScan doesn't replace a good dentist, though. It only shows the misalignment. It's still up to your dentist to actually fix the problem.
Make sure to use the brand name T-scan, because if a potential patient sees an article or news program about the T-scan, they will recognize the name and search for a local dentist that uses the system. Because you have included the brand name in your advertising plans and on your website, the patient can easily find you. The T-scan system sets you apart from your competition. Include the fact that you have the technology and what the benefits are in your advertising campaign, promote it on your website, get your staff involved, and let your patients know it's available. The T-scan system can save valuable time and money, help improve results, minimize destructive forces, enhance comfort, and eliminate extra visits. Remember to include information about the system in your on-hold messages and encourage patients to ask about it. The T-scan can help drive new business to your practice.